proper use of Skinfold measurements can be very beneficial in tracking changes in body percentage throughout the body from physical activity. Before starting a training program, measuring body fat through Skinfold measurements will help to provide quantitative information of the change in body composition. A major proponent for Skinfold measurement is that it is very practical and does not require much equipment. A skin caliper would be the only piece of equipment you need. The calipers would be used to measure the thickness of the subcutaneous layer of fat, although this test will only show an estimate that's based on the principle that the amount of subcutaneous fat is proportional to the total amount of body fat. However, subcutaneous fat will vary with sex, age, ethnicity, and gender. These factors can contribute to measurement error within Skinfold assessment. A uncalibrated caliper. A subject that is extremely obese or extremely lean will increase standard error as well. Poor technique by an unexperienced assessor can also lead to inaccuracies. Release the scissor-like grip of the caliper's claws while continuing to support the weight of the calipers with that hand. Record the reading on the caliper's scale for 1 to 2 seconds. After releasing the scissor grip lever, allow the jaws of the calipers to measure the Skinfold site. Measure the Skinfold to the nearest 0.5 mm. Be sure, however, to have the subject relax the area prior to measurement. You should grasp the Skinfold site with your 2 fingers about 8 cm apart on a line that is perpendicular to the long axis of the Skinfold site. You should be able to form a fold that has roughly parallel sides. Measure each Skinfold site at least twice. If duplicate measurements are not within 1 or 2 mm, retest this site. All Skinfolds should be taken on the right side of the body. Hold calipers in your right hand with the scale facing up to ease your viewing. Place contact surfaces on the calipers 1 cm below your fingers. The calipers should be placed on the exact Skinfold site, whereas your fingers should be above the site by 1 cm. Place the tips of the calipers on the double fold of skin and fat. Firmly grasp a double fold of skin and the subcutaneous fat between the thumb and index finger of your left hand and lift up and away from the body. Be certain that you have not grasped any muscle in this procedure and that you have taken up all the fat. Sum the mean or average of each Skinfold site to determine percent body fat. You can use specific Skinfold equations to determine body density and percent body fat. These equations can be found in other sources. The abdominal site will have a vertical fold 2 cm to the right side of the umbilicus. The triceps region will have a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely to the side of the body. The pectoral area will be a diagonal fold, 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. The mid-axillary area will have a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary. The subscapular region will have a diagonal fold 1 to 2 cm below the inferior angle of the scapula. The suprailiac region will have a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The thigh will have a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Remember to note that all the weight must be shifted to the foot that is not being measured.